There are many causes for depression, for a person to experience depression, and one is biological factors that cause it. There is a very strong correlation genetically for a person to experience depression in their life if it's in their family tree. In fact, if one parent is diagnosed with clinical depression, there's a 50% chance that each of the children in the family could come down with some form of clinical depression. And if you have two parents in a family that are diagnosed with clinical depression, there's a 75 to 85% chance that each of the offspring will come down with some form of clinical depression over the course of their life. So there's a very, very strong correlation with genetics and depression. If someone in your family has experienced clinical depression, there's a likelihood that you could as well. So you want to be aware of what the symptoms are. You want to be able to keep your finger on the pulse, so to speak, for your own depression. Treatment might actually be beneficial for you. There are other causes of clinical depression as well. One that's frequently overlooked is brain injury. People don't think about that, and it is much more common than you would generally think. Any kind of blow to the head can cause trauma to the brain that actually can lead to depression in a person's life. It can be as simple as being hit with a soccer ball, or falling off a bicycle, or getting hit with a baseball. There are other forms of brain trauma as well. But even small forms of brain trauma that you don't even think about, that aren't going to land you in the hospital with a concussion, actually build up over time and can create issues of depression for people. See, depression in the brain locates itself in the deep limbic system of the brain. It can be traumatized by a blow simply because the brain itself is the consistency of yogurt. And you have it in an enclosed system. And people have this myth that they believe that the casing of the brain, the skull, is smooth, and it's not. The inside casing of the skull has a lot of ridges, has a lot of rough areas, so that when you have a blow to the head and the brain slashes against the side, it can cause little tears and little pulls in the brain that build up scar tissue over time, and the scar tissue that it builds begins to inhibit some of the circulation that takes place. If you have enough of these consistent traumas to the brain, you can actually induce depression. It can cause a lot of other issues as well, injuring other areas of the brain, but for talking about depression, it can also affect the deep limbic system. And so it's something you really want to guard against. And you want to make sure that you have a healthy brain, and there are lots of ways of keeping a healthy brain, and exercise and proper nutrition is one of them. So if you've sustained a head injury, you want to definitely go in and you want to be evaluated. You want to have it checked out. And you also want to protect your brain as well. Riding bike, wearing a helmet, maybe avoiding some of those sports where you use your head to butt balls. It's much more common to create depression than people really think. And it happens later on in life too. When you sustain a brain injury, it's not like the next day you're feeling depression. This depression can come on 6 months to a year later, and people don't associate it with the injury. And that's one of the reasons why head injury and head trauma are not always commonly associated with depression. But if you check out people who are experiencing depression, you look back over the course of 6 months, 1 year, 2 years, you might find a head trauma that nobody ever connected to this depression. Some other causes for depression are drugs and alcohol. People, I think, pretty much know that, but I guess if you're doing the drugs and alcohol, you can go into denial and you can just pretend that it doesn't happen, but it does. Alcohol especially is a depressant, and it can exacerbate a person's experience of low self-esteem, low self-worth, slowing down the deep limbic system in the brain so that you feel this drag and this feeling of depression. It causes, and the drugs also cause a lot of damage to the brain that people don't think about. But it does have long-term effects. And as we get older, we become more susceptible to depression as well. Now, if you did drugs and alcohol at a younger age, you find that, hey, I had no problem with this. I recovered, I feel better, and then do it again and again and again. And you do the drugs and alcohol and you don't have to pay anything for it. The brain seems to be resilient. You don't notice any loss in your thinking processes. You don't notice any depression that they talk about. This isn't true. Well, as we get older, what happens is we start losing the brain cells. When we're younger, we damage these brain cells with drugs and alcohol, but we don't notice it as readily because other cells are compensating for the damage that we've done. So it kind of smooths over it. As we get older, we start losing those cells that are doing the compensating, and we find ourselves deteriorating much faster than the other people around us as we get older because we've damaged those areas of our brain that now no longer can compensate. So you'll find that people as they get older who did drugs and alcohol suffer more depression as they get older. For more information on depression, you can go onto my website at latherapist.com, and for self-help you can check out my other website, which is hypnocd.com. I'm happy to answer any questions that you have.